All right, now we're moving into the Ortho Neuro station. So now you're at station 7. So Mr. Reed is a 36-year-old warehouse worker with low back pain. They want you to perform heel-toe walk, Desjardins, Kemp's, straight leg raiser and Braggart's, Ober's test, and they would like you to verbalize what a positive finding indicates. So you have an awful lot to do here. So how much of a sheet of paper are we using now? About a third of a sheet of paper. So look back at your roadmap. We said on that third of a sheet of paper that in the middle you would write down these few things that you're asked to do. But on the left side of that sheet of paper you would write, hey, what kind of prep is important? What should I be mindful of to help me be successful and get the right information? And then collect the data on the far side of the paper. So refer back to that to make sure that you're organizing your thoughts properly and doing a good job. Okay, you have 5 minutes to get this done. 90 seconds to get these written down, start thinking, and I'll see you on the other side. Now, heel-toe walk. Should we do heel to toe or should we do heel walk and then toe walk? Let's take a look at the rest of this case, and we're not getting much information from this. So this is a really difficult call. I would have done heel walk and toe walk. Okay, because nothing else, because we've got Kemp's, which is basically low back radiculopathy versus sclerotongist referral. We've got straight leg razor, which is radiculopathy. We've got Ober. So all of this seems like it's peripheral nervous system. So I would do that. So remember, for heel walk, toe walk, you're going to have your patient standing beside here, and you're going to heel walk one way with them and kind of keeping your eyes and your mind on them, and then you're going to toe walk back the other way. So don't let your patient get very far from this bench. But notice that was negative. They were able to do that fine. Desjardins sign. Does it hurt when you cough, sneeze, or bear down? No, it doesn't seem to. Everything's fine. Kemp's test. It was positive bilaterally with localized pain. Now remember, for Kemp's, we can simply have the patient either seated or standing. I prefer to do it standing, and we have them lean back and lean back to either side. So just remember, I like to have them cross their arms and kind of lean back. Some of you like them to slide their hand down their leg. It doesn't matter as long as we get them into oblique extension. But we've got some generalized pain happening bilaterally. Straight leg razor and Braggart's test. Results: positive at 5 degrees. It hurts. Ow! Just barely lift these up. And Braggart's is negative, right? Ober's test. A lot of you do Ober's test a lot of different ways, so I'm not going to get into all the details. We did that in Ortho Neuro, but they should at least be side-lying, and we're testing that TFL, and we weren't getting the positive findings for that, but they might have even said it kind of hurt generalized in that area. So you may not get a positive finding, but you might get some pain or difficulty. So with that much information, and now that they're done properly, and we got the results, go see if you can do the answers.
Now let's make sure, Dr. James, they verbalized on number 5. Verbalize what a positive finding.
Okay.
Right, that's
so
a point.
You turn and tell that examiner, these aren't worth a lot, but you get a few more little gimme points. So you turn and say to that examiner that this is for tensor fasciae lata or iliotibial band syndrome. Anything like that would have been appropriate. Okay, this time we have the vitals, normal, but more history they gave us. The pain's been going on for 18 months, aggravated by lifting at work. Pain is worse over the last 6 months, so maybe we could have asked a few questions. I would have liked to have known if ice or heat helps this. You know, we've got the Desjardins, so we know it's not a space-occupying problem, but we do see that the pain radiates down into that leg, but it does not go below the knee, which means it's probably not radiculopathy. It's something localized unilateral up here. We take a look at the x-rays and we see that they're showing us there's a spondylolisthesis, so you've got to add that into the mix. So, you know, we've had a lot of normal x-rays so far, but now we've got one that is showing. Now, they're not going to write spondylolisthesis, okay? You have to be able to see that, but since I've drawn these, I was just trying to be polite. Okay, so we look down here and say, okay, where am I going with all of this? And hopefully your first thought is, well, it's a generalized pain. It looks like it's jamming joints together. They've given me spondylolisthesis. So I think the first thing I would try to decide is between 6 and 7. Now, if you remember back on your notes for X-ray, what we do to determine whether it's degenerative or isthmic is we go back here and look at the facets. And if the facets all look pretty much the same, then we are going to go with the isthmic spondylolisthesis. If there's an area that's whiter, kind of cloudy, then we go with degenerative. But remember, this is determined by looking at facets, not looking at the disc itself. All right, so we picked isthmic now. So we've got number 7. We've shown that we have that skill level. Now, if I'm picking that, I feel pretty comfortable with not going with radiculopathy. That would all be pain below the knee. Okay, so I like sclerotogist referral. So I'm liking those two so far. I can't pick TFL because they had a negative Aubers. Right? It didn't go down to the knee. There was no pain there. So even if they'd said localized, Aubers has to go all the way to the knee to really be a positive. So if Facet syndrome looks like that, would have sclerotogist referral. It would hurt when they do the caps. So it looks like we've got good answers for 5, 7, and 10. So 5, 7, and 10. Now they'd like our initial case management. All right, we didn't ask if ice or heat would help, so we've got to kind of come up with whether or not we want to do ice or heat. So lumbosacral support, I don't think so, because it looks like, well, it's a possibility maybe with the spondylolisthesis. But she was how old?
She was.
She was. Do you remember, Dr. Laura?
I think she was around 35 or so.
She's
30,
around
36,
35.
36.
Okay, so definitely Boston brace is out. She's too old for a Boston brace. She's McKinsey we can use just about any time. So we have a possibility of McKinsey's, a lumbar support of McKinsey's, and ice. We've got trochanteric belt we don't want to pick. Okay, because we know we're not going with the greater trochanter, trochanteric bursitis, those kinds of things. Heavy lifting, decrease heavy lifting. What was she doing? Aggravated by lifting at work. Bingo. We've got one that relates directly to the case. I am stuck on this. I'm married to that one. Okay, adjust the lumbar spine only. I hate when they say the word only. I hate it. Don't you? And the pelvis looks like it's involved. We can't pick that one. That one's bad. So that's absolutely no. Bed rest for 2 weeks, absolutely no. Ergonomic considerations for work. And she's got to do a lot of lifting at work. I think that's important. Okay, I like ergonomics. I like the decreased heavy lifting. Now out of this mess over here, what do I pick? Do I like the belt? Do I like the ice? Do I like the diathermy? Do I like the McKinsey? Which one is probably the best answer? I'm going to tell you right now, this is a real crapshoot. Because you probably might get a partial point for any of these. Because McKinsey has so many exercises for so many different areas, but it's spine only, spine only, spine only, and this looks like it could be a spondylolisthesis with facet irritation, so I think he is more disc-oriented. I think I wouldn't pick him. I think I like the cryotherapy for the SI joint because the pain hurt when we lifted her legs up just a few degrees, so there's probably SI involvement. This is strictly for the spine, so I think this is strictly just for the spine. Let's go with cryotherapy for the SI joint and take care of that. So the answers would be 2, 7, and 10. But a tough call on the third answer. And it's okay to get 2 out of it, 2 out of the 3. All right, we're to station 9 already. Mr. Smith is a 55-year-old truck driver with tailbone pain of 3 days duration. Valsalva, Milgrams, Lewin-Gainsland, SI resisted abduction, and Yeomans. Sometimes when they give a new test, they often do something that describes it. So do something close. We did talk about this one, but you never know what they'll add. So we'll see you on the other side of this. All right, now we take care of our Mr. Smith, and it is a negative Valsalva when we ask to bear down. Milgram's test, lifting the legs. Oh, no pain. Didn't hold him up. Okay, now he might say that there's pain, but it would just be his tailbone. So that would be a negative Milgram's. Lewin-Gainsland. Now Lewin-Gainsland's test is when we turn them on their side, draw the leg up, they're holding it, and we stress back the SI joint. Okay, that had a negative bilaterally, but again, there might be some tailbone pain. The SI resisted abduction is they're on their side. They bring this back slightly. They're pushing up while you're pushing down, so that isolates the SI joint. And then the Yeoman's test is the patient is prone. We bend their knee. We stabilize that same joint, and again, stress that. So you get nothing from this. Nothing. So what should you do with that minute that's left in the room? Well, Mr. Smith, you said this pain came on 3 days ago. Are you having any problems? I'm going to the bathroom, voiding, bowel pain. Did you fall down? Are you taking any medications? Are you seeing a doctor for this? Okay, so we walk into the next room. We find his vitals are normal, but his dad died of prostate cancer. Ding, ding, ding. Okay, he has incontinence, dribbling, so maybe if you'd have asked about that, you would have gotten that, so that 90 seconds in the hall wouldn't be sheer panic for you. Okay, and so we go on to see that Dr. Laura, I can't read it. Can you help me?
Problems starting the urine stream. which is MD attributed to old age, quote unquote. Only he's 55. He's not sexually active, and his bowel movements are okay.
So, calcium and SED are normal. So at this point, the calcium kind of rules out maybe metastasis, but we should all be thinking right about now that there's some prostate involvement. So we take a look over here. They're showing us a hazy area around the prostate. That prostate can look a lot of different ways if it's malignant, but at least they're trying to show us, hey, think about here, you know, his dad has prostate cancer, the pain's in the middle, think central location. So let's take a look at what we're going to pick. Okay, so what things just make no sense? We've ruled out SI involvement, we've ruled out sciatica, we've ruled out kidney problems, we've ruled out cauda equina because he does have some urinary problems, but he is able to void. It said incontinence, so I suppose it could still be a player. Let's see what we've got then. I like the prostatic cancer. I like picking that answer because it's painful and a problem. So then I look at the rest of this and I go, well, prostatitis would fit in and benign prostatic hypertrophy because we really don't know what's wrong with this prostate. So I like those three answers centered around the prostate as the best answers. Now, if it came down to picking some more of these, cauda equina syndrome would be a pretty decent fourth answer. But I think I'm going to stick to all three prostate answers. If you selected it, I'm going to tell you, you might even have gotten a half a point for it because at least you're thinking about the fact that he had incontinence. Now, further studies. I want to find out what's going on with that prostate. So, we got to order a PSA because they didn't order it up there. Now, had they ordered it in the labs, I wouldn't have ordered it down here, but they haven't done it. Trochanteric belt's kind of silly. Reflex is silly. Acid phos is another decent test for the prostate. Now, alkaline phos tells us about bone, but the calcium's already negative, so I don't know that we necessarily need to go there. So these two sound like the best specific for the prostate right now. But let's see, transrectal ultrasound. You know what? That'll tell you about the prostate. You have to just realize where the prostate is, and that's the only way you can ultrasound it. So if you made sense of that and picked that, bingo, good for you. We don't want to do a trial of care. He needs to have the prostate focused on right now, and then we can initiate or co-care. So co-care for as an answer might have been appropriate. But refer to orthopedics, KUB for the flat plate abdomen we don't need, and a pilogram. So I hope you selected as I did. Number 1, number 4, and number 6. I will tell you number 4 is usually not done all by itself, so if you had a hard time with that one, that's okay too. So let's go back to what we said. 2 out of 3, 2 out of 3 was great for me, okay? You would be doing very well at this point.
So for the differential diagnosis, you chose 1, 2, and 6.
In further studies, I picked 1, 4, and 6. We're already to station 11. Remember giving yourself 90 seconds to get your third of a sheet of paper ready, and then 5 minutes in this room. Again, we'll see you on the other side, and we'll talk about, so go ahead and do the station, try to answer your questions, and then we'll talk about the case. So this lady, if you ask her, she's holding her thumb, if you talk about it, she's going to tell you how it's tingling, it's numb, and the pain's radiating to it. So already you should be getting the idea that there's a nerve root problem. Okay, if it's radiating down to it. Now, if it just stays local, then that can be carpal tunnel, some other things. But we should have had a little discussion with her when we first walked in, like, where's the pain? Okay, now the compression test was positive on the right side, and it went all the way down to these 2 digits. Okay, the shoulder depressor positive on the right side with just localized pain, but kind of radiating out. Writes verbalized what indicates a positive test, which would be the thoracic outlet syndrome was negative, and then performed the bicep brachioradius and tricep reflexes. I'm not going to try to show those on the dowel, but you can refer back to your notes or the tapes on those if you need to know how to do this. Now I want to talk to you about some about these dermatomes. Here's the cotton ball. Here's what it's going to feel like by your knee. I need you to shut your eyes and compare one side to the other. And you did all of C5, you did all of C6, you did all of C7, comparing one side to another. And often they have you verbalize what you're in. So C5 feel the same on both sides. The C6 feel the same on both sides. The C7 feel the same on both sides. It's about the way you want to handle that. And she has lost C6 on the right. So it's sounding more and more like a radiculopathy. You walk into the next room. and we have normal vitals. Got a little more history. So again, if you can ask some of these questions, you might get some more information while you're even in the room above. But the pain started while painting the bathroom ceiling yesterday, and no trauma. Sometimes they give very little of this, and you have to find out this information while talking to the patient. So the additional information is getting much scantier and much less of it in this follow-up room, and you have to ask some decent questions with your patient encounter. Notice they showed us an oblique, so we should be thinking about the fact that we could be seeing the IVF encroachment with the pseudofracture line. The IVF's encroached here. She told us that it hurt when she coughed, sneezed, or bear down if you asked her, so I will tell you that probably saying degenerative disc disease, picking IVF encroachment, become pretty obvious answers. Now, how did we rule out thoracic outlet syndrome? Was because she said it was a negative with rights. So we got rid of that answer there. So space-occupying lesion becomes the plausible disc answer. So we've got D, D, D. That's your discopathy. That's one. We've got IVF encroachment off of our cervical, our lateral, that could be the cause of it. And we've got the fact that because she didn't, whether or not she said it was a space-occupying lesion, that would be your diff dye. And then the space-occupying lesion still stays in the mix if we think it's a disc. So 1, 4, and 7. Then we move into initial case management. And I'd like to, ice, brace, get some chiropractic care kind of going here. So sounds like adjusting our cervical spine. We'll want to get that going. I'd probably want to ice it because I think it was just a pretty recent, wasn't it? And then number 9 here is the interferential, because that can get some of the edema. That can be used for both acute and chronic. So interferential is kind of a great edema pusher. So I think number 1 and number 3 and number 9 become a very good collection of answers. Now let's just talk about this. Too soon for heat. Immobilizing with a cervical collar is a pretty good 4th answer if she'd had trauma or something. But as I recall, how did this come on, Dr. Laura? She was painting the bathroom ceiling yesterday. No trauma. So I'm not so sure that we want to head to heat. So heat was next. Immobilizing with a cervical collar, not necessary unless we thought things were kind of unstable from a car accident. And we don't really like collars anyway, so we always try to find something else to pick. Nerve conduction velocity would be if the pain only stayed in her hand, because that would make it a neuropathy. Then you'd want to confirm that by putting the pins on either side, comparing, and you would see it was slower on the side with compression. So that isn't appropriate for radiculopathy. The extension exercises we don't really need at this point. Maybe a nice 4th or 5th answer is to throw in some McKinsey exercises. Hydroculator pack, you'd have to pick heat. And you'd have to pick both 7 and 4 if you were picking them, and stretching the scalenes would go along with the thoracic outlet syndrome, which we said we had ruled that out with the Wright's test. So we are left with then number 1, number 3, and number 9 as our correct answers for treatment.